You're going to get done like about midnight tonight. You know that, right? Senator Hill.
You are short of members here.
Senator Hill, welcome.
Thank you, Mr. Chair.
Please proceed.
Members, SB 396 would allow ambulatory surgical clinics, which are Medicare certified, to have the option of being licensed by the Department of Public Health. It would also provide that an accredited outpatient setting, which is regulated by the medical board, is required to perform peer review of physicians and surgeons and other medical staff within its facility. That the outpatient setting must also provide specific information to the Office of Statewide Health Planning and Development, OSHPD, about the patients they serve and the care they provide, and would allow for unannounced inspections by the medical board and accreditors of outpatient settings. The primary reason for allowing ambulatory surgical clinics to be licensed is because the department currently has jurisdiction over ambulatory surgical clinics which have Medicare certification, and yet because of a legal decision, they were no longer allowed to license these clinics. After the legal decision, the only recourse these clinics had was to become accredited, which places them under the medical board's jurisdiction. By allowing licensure with the department, the ambulatory surgical clinics will now be under the oversight of one agency and not have to meet dual and multiple requirements for operating in California. Concerns have been raised by the California Society of Plastic Surgeons and the California Medical Association regarding the reporting requirements to OSHPD and allowing unannounced inspections by the medical board or accreditors. We have agreed to continue working with the Society and the CMA to clarify both of these. I have with me Bryce Doherty, representing the California Ambulatory Surgery Association, and Jennifer Simoes from the Medical Board, who can answer any questions you may have. And I would also like at this time to accept the technical amendments reflected in the analysis.
Thank you. Please proceed.
Mr. Chair and members, Bryce Doherty on behalf of the California Ambulatory Surgery Association, commonly referred to as CASA. We represent over 300 ambulatory surgery centers across California. That's kind of the call term for these facilities. As the analysis points out, there's actually 3 pathways for a facility like ours to be regulated here in California. If you're rendering a level of anesthesia that puts the patient in a state where they're losing all forms of life-saving motor skills, you have to meet one of 3 regulatory requirements. One of which is you have to be accredited by an accrediting agency that's overseen by the Medical Board of California. 2, you can be state licensed by the Department of Public Health, and 3, you can be Medicare certified. You have to meet one of the 3 requirements. As the Senator has pointed out, there was a legal decision in 2006 that rendered the pathway for about 95% of the surgery centers in the state to not be licensed by the Department of Public Health and not be state licensed. We think that's a problem. We've worked for many years to make sure that we have a clear, concise, and comprehensive set of not only state licensure requirements, but regulatory oversight of these facilities. To the credit of the chair, Mr. Hernandez had a legislation 2 years ago, SB 534, that's mentioned in your analysis. That bill basically stipulated that if you are a surgical clinic licensed by the Department of Public Health, the regulations for licensure shall be the Medicare certification requirements until such time the department promulgates regulations. So we're supportive of the provisions that allow for the permissive licensure of ASCs, and we're also strongly supportive of a provision in the bill that allows these facilities, whether they're accredited or Medicare certified, to have access to the 805 reports that the medical board houses. And those reports are important for these facilities because they need access to those reports for purposes of credentialing these physicians in these facilities, and they want to make sure that there's no restrictions on any of their existing hospital or other facility privileges. So for all those reasons, we strongly support the bill. Thank you.
Thank you. Anyone else in support?
Jennifer Simoes with the Medical Board of California in support. Currently, there's a serious deficiency of accredited outpatient setting data. This bill would require these outpatient settings to report the same aggregate utilization and patient encounter data that licensed surgical clinics are already required to report to OSHPD. This bill would require peer review, and these peer review evaluations can be used as an important tool to ensure that existing accreditation requirements are being met. Lastly, this bill would require that outpatient setting facility inspections be unannounced, and this would be in line with inspections on other types of ASCs. For these reasons, the board is respectfully request your aye vote. Thank you.
Thank you.
Connie Delgado with the California Hospital Association in support of the bill.
Thank you. Anyone else support? Opposition?
Good afternoon. Alicia Sanchez with the California Medical Association. We have a pose unless amended position, and we do really appreciate the amendments that have been taken to date, and as the author mentioned, are continuing to have conversations. Our opposition stems from the fact that many of these ambulatory surgery centers, despite the name, are oftentimes small offices, so have fewer than 5 practitioners, oftentimes 1 or 2. And we want to ensure that the requirements that are being established take into account the way that the requirements might disproportionately impact those facilities. So want to make sure that the unannounced visits requirements don't in fact place additional burdens on them to have increased surveys, because it's important for the surveyor to actually see a procedure being undertaken. And if there's no procedures being done that day and they have to come back, that increases the cost on the facility. And if they don't see a procedure, that also decreases patient safety. And as well, wanting to better understand the data that's collected and the questions that we're seeking to address with that data to ensure that, again, it doesn't create an undue burden on those small facilities.
Thank you. Anyone else in opposition?
Mr. Chair, members, Tim Madden representing the California Society of Plastic Surgeons. We would also like to thank the author and sponsors and the author staff, particularly for working with us on some of our concerns, particularly with the most recent amendments. We do remain in an opposed position for some of the reasons that the CMA outlined. In addition, with the reporting requirements, our folks are not opposed to reporting data as long as it's data that's used for some specific purpose that helps improve patient care. We continue to have conversations with the senator and staff to explore different approaches to the reporting data to help it improve patient safety.
Thank you. Anyone else in opposition? Questions from any of the members? See no questions from the members. Is there a motion? I'll move the bill. Senator, would you like to close?
Mr. Chair, members, thank you.
Thank you. We're on item number 10, SB 396 Hill, do pass as amended to appropriations. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Wynn.
Aye.
Wynn, aye. Hall. Mitchell. Aye. Mitchell, aye. Monning. Nielsen. Pan. Roth. Wolk.
It currently has 3. We're short some members. We'll place that bill on call. We're at item number 21, SB 671, Hill Pharmacy Biological Products. Go ahead and proceed.
Thank you, Mr. Chair. First, happy to accept the technical amendments on page 8 of the analysis. 2 years ago, almost every one of you on this committee voted to support a similar version of this bill. The only difference this time around is that several entities that used to oppose the bill now support it. 2 years ago, opposition argued that the bill was premature and that doctor communication was bad. Now everyone agrees that we must act to allow substitution since the FDA approved the first biosimilar last month. Almost everyone also agrees that doctor communication is necessary. SB 671 allows lower-cost biosimilars to be automatically substituted by a pharmacist. It also requires that the pharmacist communicate with the physician about the substitution within 5 days after the prescription is filled. Since the majority of healthcare providers are using electronic medical records, the communication will be as easy as a click of a button. Pharmacies already communicate with physicians millions of times per month in California. This bill would only add a few more per month. The physician communication in this bill is similar to the chair's SB 1301 from 2012, which required communication if a pharmacist extends a prescription from 30 days to 90 days. That bill had unanimous bipartisan support. It's also similar to the chair's SB 493 from 2013, which also had unanimous bipartisan support. That bill required advanced practice pharmacists to communicate with physicians when they make therapeutic substitutions of medications. Some opponents are trying to weaken the physician communication requirement in this bill. They're proposing amendments to change communication from to a physician to prescribers. Under this scenario, the patient's doctor wouldn't necessarily get the information. Another amendment exempts cash payers and others from communication to a doctor. Under this scenario, patients with insurance will get doctor communication, but those paying out of their pocket will not. I'm hopeful that an agreement on reasonable amendments can come together in the very near future. This bill is critical so pharmacists can more easily provide lower-cost drugs to patients and so doctors can have access to complete medical records for their patients. Thank you, Mr. Chair.
Thank you. Please, those in support, please state your name and your position.
Good afternoon. William Yoon, National Director for Sandoz Biopharmaceuticals. Good afternoon, Chairman Hernandez and members. My name is William Yoon. I'm a National Director for Clinical Development Medical Affairs for Sandoz Biopharmaceuticals. I'm here today to support Senate Bill 671. Sandoz, a generic manufacturer division for Novartis, is the world leader in developing, commercializing, and marketing biosimilars with greater than 50% share in highly regulated markets. We also manufacture brand biologics as well. Our products around biosimilars are approved in greater than 50 countries worldwide, and we have generated more than 200 million patient days of experience. I'm proud to say that we are the first company to have the first FDA approval of a biosimilar here in the US that occurred on March 6. Ironically enough, which is an Amgen product, and my colleague here to my left, Jeff, that represents. The FDA has also reported that there are another 4 applications for biosimilars pending, along with 2 possible applications for interchangeability. In 2013, Sandoz and Novartis, we sat on the other side of the table from Senator Hill. We strongly opposed SB 598 due to prescriber notification requirements, which could inhibit competition. Since then, we have collaborated our differences and now fully support SB 671 because it promotes competition while giving prescribers the information that they need. Currently, SB 671 represents compromised language and levels the playing field between a branded biologic and biosimilar for which FDA has designated as interchangeable. Sandoz and our parent company Novartis, together with several key organizations here today with extensive experience in manufacturing and sale of biosimilars, support the introduction of equitable, consistent, and pro-competitive state-level legislation that paves the way that reflects this pragmatic approach. And I ask you and urge your aye vote. Thank you for your attention.
Thank you. Anyone else in support?
Good afternoon, Chairman Hernandez. Jeffrey Ike at Amgen. We are a biotech company which for 35 years has been assembling the science and the scientists here in California to move biotechnology into applied science for patients. What many don't know is that we're also a manufacturer of biosimilars with more than $1 billion investment into a portfolio of biosimilars to increase access to biologic medicines that will be made here in California for patients here and around the world. We strongly support SB 671. It increases access to biologic medicines and also does so in a way that preserves the patient-physician relationship and ensures that each patient's healthcare team has the full understanding of the medications that are in the patient's body. As you know, the practice of healthcare is regulated at the state level, and the FDA has made clear that they will approve biosimilar and interchangeable medicines, and that the manner in which those medicines are used, dispensed, and substituted will be left to the state discretion. Rules that stipulate complete and accurate patient medication records are fundamentally important to our ability to serve patients and to be accountable for our own medicines. SB 671 strikes a very important provision that enables each pharmacist physician to be fully aware of the medicines that their patients have received. Ultimately, for the biosimilar program to be successful in the United States and in California, physicians will need to opt in and make the choice to use biosimilar medicines, and patients will need to have a positive outcome and a positive experience. One of the most important aspects of this will be ensuring that the patient-physician relationship remains and that everyone is fully aware of the medicines that the patient has received. A number of the amendments proposed by the opposition are quite clever in that they appear technical in nature, but in fact they negate the very principles that this legislation seeks to achieve on behalf of the patients, physicians, and manufacturers of biosimilars that support it. The implication is that if you have information going up into the cloud that has the information on which medicine the patient has received, and if it's available to prescribers generally, it doesn't necessarily assure that the patient's individual pharmacist and physician will have access to this information. Indeed, today, 90+% of pharmacies can use electronic exchange of information. About 70% nationally of physicians are able to access this information. But if you click a layer below, in California, that number today is about 53 to 54% of physicians. And if you look at practices of 10 physicians or less, those numbers now are between 26 and 50% of physicians. So the subtle amendment actually renders the patient's physician, in many cases up to 50% of the time, unable to receive the information that will be put into the system. We fully agree that electronic exchange of information between a patient's healthcare team is essential, efficient, and accurate. And until the implementation is complete, this legislation, as it's currently crafted, also creates a mechanism for those patients and those physicians that do not have access to the electronic systems to receive the same information. I urge your passage of SB 671 today and advancement throughout the Senate and the Assembly. It's fundamentally important that this legislation is enacted into law in time for the physicians, pharmacists, and others in California to understand the provisions of it and to be able to implement it so that we can have a successful program that increases patient access to biosimilars. Thank you.
Thank you. The remainder, if we can just get, state your name and position, please. Thank you.
David Ford for the Medical Oncology Association of Southern California in support.
Dennis Loper on behalf of Lilly Company, the maker of insulin, which is the first biologic, and it's important to be included in this bill. We support the bill. Thank you.
Jeremy Smith here on behalf of the State Building and Construction Trades Council, also supportive.
Cindy Laubacher on behalf of Express Scripts in support.
Eve Bukowski with the California Healthcare Institute, and as a patient who takes biologics, in strong support.
Jennifer Snyder on behalf of the Biotechnology Industry Organization in support.
Fred Main on behalf of the Generic Pharmaceuticals Association in support.
Moira Top on behalf of Biocom in support.
Angela Blanchard for Bristol Myers Squibb in support.
Jim Gross on behalf of Merck & Company, Johnson & Johnson, Genentech, and Novo Nordisk in support.
Fred Noteware for Pharma in support.
Natalie Carreras with UCB in support.
Kristen Hare with the Arthritis Foundation in support.
Opposition? Or is there any more support? No, opposition. Please state your name and proceed.
My name is Bruce Lott, and I'm the Vice President of Global Biologics Policy for Mylan. Mylan opposes the notification requirement of Senate Bill 671 and the inclusion of products that are regulated as drugs, not biologics, by the federal government in the definition of interchangeable biologics. Mylan is a leading manufacturer of generic and specialty drugs. We market 1,300 generic and specialty medicines in 140 countries and territories. Currently, 1 out of every 11 prescriptions filled in the U.S. is filled with a Mylan product. We have 5 biosimilars, potentially interchangeables, and 3 insulins in development for the U.S. And 1 biosimilar on the market outside the U.S. Excuse me. Mylan is committed to increasing access to affordable medicines, including biologics, and we support the intent of Congress that biologics determined by FDA to be interchangeable may be substituted for the reference product without the intervention of the healthcare provider who prescribed the reference product. California Senate Bill 671 includes provisions that we believe are inconsistent with the intent of federal law for interchangeable biologics and that will result in imposing barriers to access of these more affordable medicines. We believe these provisions, which have been pursued by brand companies in the past as a means to impose barriers to substitution of generic drugs, will undermine access and savings that could be achieved from interchangeable biologics. It's important to remember that the term biosimilar that's being used here today in this discussion, but the legislation under consideration is not really about biosimilars. Biosimilars will be marketed as brand products and will not be substitutable under current law or under the law if passed. This legislation is about interchangeable biologics, and interchangeable biologics are distinct from biosimilars under federal law and are approved under distinct standards. The key difference is that while a biosimilar is required to show that it's highly similar to the brand reference product, an interchangeable biologic must show that it, quote, can be expected to produce the same, and I emphasize same, clinical result as the reference product in any given patient. In addition, for a biological product that's administered more than once to a patient, the interchangeable biologic must also provide scientific evidence to FDA that there is no additional risk from alternating or switching between the brand product and the interchangeable biologic. That's a high standard, and only products deemed safely and effectively interchangeable will receive that designation. As a result, we feel it's not only unnecessary to require a different standard for substitution of interchangeable biologics and interchangeable drugs, but that notification can also undermine confidence in these more affordable biologic medicines. The unintended consequence of notification provisions in this legislation will be higher spending for biologic medicines for patients, payers, the state, and healthcare. We also oppose the provisions related to insulins and other products approved under the Food, Drug, and Cosmetic Act being considered in the definition of interchangeable biologics. Under FDA's frequently asked questions guidance on their website about therapeutic biological products, FDA states that, quote, hormones such as insulin, glucagon, and human growth hormones are regulated under the Food, Drug, and Cosmetic Act, not as biological products under the Public Health Service Act. We believe that California and other states should regulate the products as drugs as long as the Food and Drug Administration regulates them as drugs, and regulate them as biologics only if and when the Food and Drug Administration regulates them as biologics. Thank you very much.
Thank you. Please proceed.
Hello, my name is Maral Farsi. I'm with CVS Health. We represent the largest chain drugstore in the state of California. We're also one of the largest pharmacy benefit managers in the state. And we, through our pharmacy benefit management services, we offer access to our mail service pharmacy and our specialty pharmacy. I want to respond to a couple of statements that were made earlier about the cloud and the accessibility of this information. It is in fact not as simple as a click or two or having access to this stated cloud. I have distributed some materials to the committee from an entity called SureScripts, which acts as a network for e-prescribing. So it's an intermediary for e-prescribing specifically between providers and doctors or prescribers, and pharmacies. And this document will, I've highlighted a few portions on this where it specifically outlines that there is no portal, there is no general entity where providers can access a patient's medical history. Furthermore, if you look at the back of the document, there's a portion that I've highlighted where they state that the manufacturer information is not available. There's a national drug code that is available, but as the bill is currently written, the product name and the manufacturer name would have to be disclosed. So there's just a number of issues currently that make the bill unworkable. However, as much as we don't necessarily think that notification is necessary, we think the FDA is doing its due diligence to approve these drugs, including clinical trials for interchangeable biologics. We are attempting to work with the proponents on this in order to find a way where we can take all the electronic means available and include those in the bill. So that includes any provider portals available through pharmacy benefit managers. We at CVS have a PBM portal that doctors can log into and see what drugs have been adjudicated for members, and any other electronic systems that may be available, electronic health records, et cetera. So I appreciate the opportunity to speak here today, and thank you.
Thank you. The remainder, we can just get name and position, please.
Mr. Chair, members, Brian Warren with the California Pharmacists Association. If I may very briefly, just wanted to state in response to what had been said by the supporters, we have in fact supported meaningful communication requirements to prescribers when they are clinically necessary. However, we feel that the notification requirements in this bill are not necessary. They distract from those meaningful ones, and it's for that exact same reason that last week the State Board of Pharmacy took an oppose unless amended on this bill as well. Thank you.
Thank you. Name and position, please.
Peter Kellis on behalf of Walgreens, oppose unless amended.
Don Caldwell on behalf of PCMA, the National Trade for Pharmacy Benefit Managers, oppose unless amended.
Angie Minetti with the California Retailers Association, also oppose unless amended.
Stephanie Watkins on behalf of the Association of California Life and Health Insurance Companies in opposition.
Angelica Gonzalez on behalf of Kaiser Permanente in opposition.
Jennifer Gabals with the California Association of Health Plans, also in opposition.
Thank you. Anyone else in opposition? Questions, comments from any of the members? Question, Senator Nielsen.
Just a comment, Mr. Chairman. This is a bill that's provoked a lot of scrutiny, I guess I would say, maybe not the controversy as much as scrutiny. And having reviewed it as thoroughly as I have to this point, and I do not consider myself an expert, I do applaud Senator Hill for taking on a very difficult issue and spending an awful lot of time. I'm of a mind today that it's worthy of a yes vote, but I am also of a mind there is yet more work to be done. And the yes vote is based on the good faith effort of the author to work with all parties, and I think he has tried to do that. But I do think that at least in terms of the electronic notification, that there's a lot of work yet to be done. And I'm not altogether convinced of some of the negative impacts. So please do continue to work on it, Senator.
Thank you, Senator Nielsen. Well.
Yes, Senator Pan.
Actually, Senator Hill, I just want to thank you for your work on this issue. I know this has been a multi-year effort. I think when you began, people actually went and said there are no biosimilars yet, and now there are. But mainly, this is at the early stages. They're few, but they will be growing. But we're not talking about a large number at the moment, but I think that the other thing is that these are complex molecules. I mean, we mentioned insulin. Insulin is actually fairly straightforward, fairly simple protein structure. Some of these will be fairly sophisticated ones. And I think it is important that physicians are aware of what's dispensed. We want to try to, I know you've worked to minimize the notification burden of doing that, but I think it is important that that information, at least certainly in these early stages of the use of biosimilars, is available. The FDA, is going to look for the pharmacological activity to be sure that they are similar or near identical. But because these are complex entities, side effects profiles may be slightly different, other types of things that we need to monitor as we use these really biologics moving forward. So I think this is striking a good balance between, in terms of safety and access to these very important medications, and also helping, therefore, reduce costs as well. So I'll be supporting the bill. I appreciate your leadership.
Thank you, Senator.
Thank you. Seeing no other comments, is there a motion? So moved by Senator Pan. Would you like to close?
Yeah, I would. Thank you, Senator Hernandez. And I would like to just respond to some of the comments. And I appreciate where they have, and they've been working hard on trying to resolve and come together on the communication aspect of the bill. But there are a couple of things that I think need to be pointed out. One, it's interesting that one of our major pharmacy chains, in the letter of opposition that you received, talks about potentially delaying prescriber or patient acceptance. There's nothing delaying in this bill. It's notification or it's communication 5 days after the dispensing of the product. So you're not delaying anything if the communication is 5 days after the dispensing of the product. And the opposition from these large pharmacy chains is interesting because, as I mentioned in my opening, they already do it they communicate millions of times a month in California to the physicians. And in fact, the two bills that I cited, the interesting part is these two bills actually benefited the pharmacists and the pharmacies because it allowed them to gain a greater market share, to basically sell more products. So at that point, it was a very positive thing for them, and they supported that notification. This time, they have a challenge. And I just wanted to say that there is a difference, and thank you, Dr. Pan, for pointing it out. A letter that you received in support of the bill from the National Kidney Foundation. And I'll just read a short paragraph, if I could. With biologics, we know that individual patients can respond differently to even seemingly insignificant changes in drug formulation, manufacturing process, packaging, storage, or handling. These unintended consequences could be life-threatening since biosimilars are produced without access to the innovator's proprietary manufacturing process. Differences in composition compared to the original innovator product are likely to occur. And they can occur in, as there was a problem in Europe over one of the biosimilars that was interchangeable, that it was in the cap that was used. It created a problem. The cap of the product caused a reaction in one of the patients. So if that patient does not, and that prescriber, that physician does not know what that drug is, that the specific innovator, the specific biosimilar, the specific interchangeable biosimilar, if they did not know that, they wouldn't know where to go to find out exactly what that reaction was and how to deal with that as it goes on. That's why the communication is so important. I ask for your aye vote, members. Thank you.
Thank you. This is item number 21, AB 671, as amended to appropriations. Call the members.
Hernandez.
Aye.
Hernandez, I. Wynn. Wynn, I. Hall. Mitchell. Mitchell, I. Monning. Monning, I. Nielsen. Nielsen, I. Pan. Pan, I. Roth. Wolk. Wolk, I.
That is 7. We're still going to place that bill on call. I think I saw Senator Allen.
Yeah, thank you, Mr. Chair. Thank you, members.
Thank you.